Hi, it's Dr. Stephen Greenberg, along with Dr. Jeremy Nick.
Hey everybody.
And Sarah Donahue, our head PA. So we want to take some questions today. We have tons of questions coming in right here on Nip Tuck today. So Sarah, who is our first question?
So I have Mary asking questions about weight loss. So she's lost a lot of weight recently over the past year. She did have gastric bypass surgery. She's wondering if she can get all of her surgery, all of her needs done at once.
All right.
So arms, belly, breasts, thighs. A lot of people ask for multiple things at one time.
So this is a very common thing that we see. Patients who lose a lot of weight either by themselves or with different types of gastric bypass surgeries. And Dr. Nick, why don't you explain how we put these massive weight loss patients together in terms of packages?
So patients who lose like 80 pounds, 100 pounds, they lose almost a third of their body weight, they develop a lot of extra skin. It can be in the belly, it can be in the breast, in the arms, and the thighs. All these areas create issues where patients just can't wear clothing properly, they can have rashes or sweating, and we kind of add icing to the cake after they lose so much weight.
And I think combining these procedures are very common. So we often will combine a breast lift or a breast reduction, a tummy tuck, an arm lift, a thigh lift. Combining them is quite simple to do.
Yes, and I actually think that we prefer to combine them because by dressing a certain area, we can sort of set back the clock and make that part of the body look great and function better in one surgery as opposed to many surgeries.
And it's all about safety for us. We combine what's safe, and if we have to divide the procedures, we do so. So I hope that answers Mary's question. All right, who else do you have for us?
Second question is from a male patient. He is trying to lose weight. He's lost some weight, but he can't lose it in his chest area. He said his nipples are a little bit puffy. They look a little bit bigger. He wants to get rid of them.
So that's called gynecomastia, and gynecomastia is an enlargement of the male chest, and it can be from three things: skin, fat, or breast tissue.
Right, and the way you know the difference is many men who try to lose weight in this situation or work out or bodybuilders, they can get rid of that breast tissue as is existing in their chest. It has to be removed, there's no other way.
Sometimes gynecomastia or enlargement of the male chest is from using different medications or marijuana, or it's just genetics. So it's hard to get rid of on your own. It's super common. Some studies show that 30 to 50% of guys in some point of their life have enlargement of the chest, and we do it right here in the office ambulatory center.
Right, it's an ambulatory procedure. You come in the same day, you go home the same day. Surgery does not take long at all. We usually combine liposuction of the chest with a small removal of that tissue that can be done together within an hour, I would say.
So quite simple. Guys out there have a little bit of enlargement of the chest. Dr. Nick and I do them right here in our office ambulatory centers. All right, last question.
Last question is about the eyes. This patient is wondering what you can do about her puffy eyelids, underneath and above.
Okay, so there are patients who have extra skin in their upper lids, like up here. There are certain patients who have puffiness in their lower lids, like there.
Definitely not Sarah.
And not Sarah. But Dr. Nick, why don't you explain how we get rid of that extra skin and that extra puffiness?
Right, we designed to remove the skin in the natural crease where you cannot see where the removal took place. So we remove the extra skin above the eyelids in both locations. While we're in there, we like to pluck out a little bit of that fat sticking out that makes you look tired, like you have, bags under your eyes or above your eyes.
And upper and lower eyelid lifts done in all ages, both men and women, and done right here with a very fast recovery. So if you have that extra loose skin up there, if you have the baggy eyelids or the extra skin or extra puffiness in your lower lids, very simple procedure done right here at the Greenberg Cosmetic Surgery offices by both Dr. Nick and myself. It's Dr. Stephen Greenberg, Dr. Jeremy Nick, Sarah, GreenbergCosmeticSurgery.com. We look forward to seeing you next time, guys.
Take care.